Hi, Mr. Thomas. I'm your student nurse, Sarah, and I know you just learned that you have coronary artery disease and that you probably have some questions and concerns about what this means and how it affects your health. So let's take a few minutes to go over how to understand this diagnosis and also what's happening in your heart and what to watch for moving forward. Your heart's job is to pump oxygen-rich blood throughout your body. And to do that, the heart itself needs oxygen. And it gets that from small blood vessels called coronary arteries. Over time, these arteries can collect a buildup of plaque, which is a sticky mix of cholesterol, fat, and other materials. This buildup is called atherosclerosis. As plaque builds up, the arteries become narrow and stiff, making it harder for the blood to flow. When your heart doesn't pump enough oxygen, you might feel chest pressure, heaviness, or pain. That's called angina. Now, sometimes this chest pain happens when you're active or stressed, and it goes away with rest. That's called stable angina. But if your pain starts happening more often, lasts longer, or happens even when you're resting, that's called unstable angina, and it's more serious. Unstable angina is part of something called acute coronary syndrome, or ACS. It's an umbrella term for sudden problems that happen when blood flow to the heart muscles drops sharply or gets blocked completely. Here's how it works. So sometimes a plaque inside the artery breaks open, forming a blood clot, and if that clot partly blocks blood flow, you may have unstable angina, meaning your heart is struggling but not yet damaged. If the clot completely blocks blood flow, cells to the heart may begin to die. That's called a myocardial infarction or heart attack. During a heart attack, the longer blood flow is blocked, the more damage it can cause. That's why getting emergency care right away is so important. So if you ever have new or worsening chest pain spreading to your jaw or arm, shortness of breath, sweating, or nausea, call 911 immediately. The good news is that we can treat and manage coronary artery disease. We use medications to lower cholesterol, control your blood pressure, and prevent clots. Examples of these medications include pharmaceutical classes like statins, beta blockers, and ACE inhibitors. If you're prescribed any medications to treat coronary artery disease, it's very important that you take them consistently as prescribed. Lifestyle changes matter too. So eating heart healthy foods, staying active, and not smoking all make a huge difference. Remember, coronary artery disease doesn't have to control your life. By understanding what's happening inside your heart and acting quickly when symptoms change, you can protect your heart and keep doing the things you love.